What doesn't cause miscarriage? While we know what things can cause or increase the risk of miscarriage, there are still plenty of myths surrounding miscarriage. We asked Dr. Schaffir to debunk some major misconceptions about miscarriages. It's important for women to understand that these are just old wives' tales, and not only are they not true but in some cases, believing them can affect your health and well-being, he says. Here are 4 things that absolutely cannot be blamed for a pregnancy loss. 1. Exercise. Exercising or picking up a reasonably heavy object, such as a grocery bag, a toddler, or the like, are extremely unlikely to cause a miscarriage. In fact, most experts agree that exercise during pregnancy, with your doctor's approval, can lower miscarriage risk and make you and your baby healthier. That's because exercise reduces stress, relieves aches and pains, lowers your risk of gestational diabetes, and even builds up stamina for labor. As long as you're continuing exercise you did pre-pregnancy, not suddenly taking on Olympic weightlifting, exercise during pregnancy is perfectly safe. 2. Stress on its own. While some studies on stress and miscarriage are conflicting, Dr. Schaffir says that everyday tension or anxiety, tight deadlines at work or worrying about what labor will be like, have not been linked to pregnancy loss. What's more, no studies have ever linked excessive bad moods to miscarriage, says Dr. Schaffir. Things get murky when dealing with major stress, though. We're talking big things, like the death of a spouse or parent, he explains, and even then, the link is not well established. Plus, pregnant people who are under extreme stress are also more likely to smoke, drink, or do drugs to cope, which can affect their risk of miscarrying. 3. Food that's properly cooked. Pregnant people should maintain a healthy and nutritious diet throughout pregnancy. While foods themselves don't cause miscarriage, certain foods come with higher risks of foodborne illnesses like listeriosis, an infection caused by the bacteria Listeria monocytogenes. Severe cases of listeriosis and other foodborne illnesses have been linked to miscarriage and pregnancy complications, which is why experts recommend avoiding certain foods during pregnancy. You should avoid, for example, raw meat and fish, soft cheese, unpasteurized cheese, and deli meat. 4. Sex. In general, sex and sex acts with genitals, toys, or fingers are considered safe during pregnancy. The fetus is protected not only by amniotic fluid but also by the powerful muscles of the uterine walls. As long as the pregnancy is low risk, the fetus is developing on a typical track, and there are no concerns about preterm labor or other complications, sex during pregnancy is likely safe, according to the Mayo Clinic. If you're concerned, however, don't hesitate to ask your doctor or midwife.